Endometriosis is not just a medical condition. It is a clinical challenge that is often underestimated and diagnosed too late. Many patients live for years with pelvic pain, discomfort, or infertility without a clear diagnosis. In many cases, their symptoms are considered normal or not taken seriously enough. And this is exactly where imaging can make a difference. Ultrasound is usually the first imaging tool used to evaluate the female pelvis. It is widely available, non-invasive, and provides real-time information, but it also has an important limitation. It is strongly dependent on the operator, and this is a key point, because in endometriosis the problem is not just the disease itself, but the fact that is often not recognized early. To understand this, we need to start from anatomy. The uterus is located between the bladder and the rectum. Its position can change depending on physiological conditions such as a bladder filling. The endometrium, which is the inner layer, changes during the menstrual cycle in both thickness and appearance. Right after menstruation, it appears as a thin line, while later it becomes thicker and more structured. The myometrium, the muscular layer, is usually homogeneous, but it may contain vascular structures. The ovaries are located close to the iliac vessels and change continuously during the cycle. We can observe small follicles in the early phase, and later the dominant follicle grows and eventually forms the corpus luteum. And all these changes are normal, but they make the interpretation more complex. When we evaluate a patient with suspected endometriosis, the challenge is not only to identify clear abnormalities, but also to recognize subtle signs. Some lesions are small, and others are located in deeper areas and are not easy to visualize. Sometimes the findings are indirect. Without the correct technique and a systematic approach, these signs can be missed. This is where technology and application expertise become essential. Image quality is important, but is not enough on its own. The operator must know how to use the system correctly. This includes choosing the right probe, adjusting depth and gain, and using the correct scanning planes. A systematic evaluation of the uterus, ovaries, and surrounding structures helps reduce the risk of missing important findings. For example, knowing how the endometrium should appear in different phases of the cycle helps avoid confusion with pathological conditions. In the same way, understanding the normal appearance of the ovarian follicle is essential to distinguish them from cysts or other abnormalities. And this brings us to the role of the clinical application specialist. The value of a CAS is not only in knowing how the machine works, it is in helping clinicians use the system in the best possible way. This means improving image acquisition, supporting correct interpretation, and reducing variability between operators. In daily practice, this can have a direct impact on patient care. In the context of endometriosis, better imaging means early suspicion, more accurate evaluation, and better clinician decisions. And this is very important because delayed diagnosis can affect the quality of life for many years. Technology alone cannot solve this problem. What really makes the difference is the integration between technology and clinical understanding. A well-performed ultrasound exam is not just about seeing structures. It is about understanding what we are seeing, and this requires both technical knowledge and clinical awareness. As a biomedical engineer with several years of experience in clinical engineering, my role is to work at the interface between technology and clinical practice. I don't replace the clinicians. My contribution is to support clinicians in getting best possible performance from the system. This means helping to optimize image quality, improving acquisition techniques, and ensuring that the technology is used in the most effective way. Because better images lead to more reliable information, and the more reliable information supports faster and more accurate clinical decisions. In the end, the goal is not just to produce images, but it is to make sure that the technology truly supports patient care and to ensure that what remains misunderstood is the disease and not the patient. Thank you for watching.